Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. This presentation is about ticks. Ticks have 4 life stages: the egg, the 6-legged larva, the 8-legged nymph, and the adult. It may take 3 years for them to complete their life cycle, but most will die before this time because they won't find a host to feed on. Ticks are more active in warmer months from April to September. You can see the image on the left has an example of the life cycle of the tick. The image on the right shows the comparison of the tick size to a dime. Ticks find their host by detecting breath, detecting body odors, sensing body heat, sensing moisture, and sensing vibrations. They rest in a wait of a host on the tips of grass or on shrubbery. They can't jump or fly. Ticks climb onto their hosts whenever the host brushes past their resting area. They typically attach to a host quickly whenever they find skin. They may crawl to different body areas, including the ears, within the hair, and in dark areas. Ticks feed for several days, and most detach after feeding. Tick bites can cause local reactions such as redness, swelling, and skin sores. They eat blood at all stages of life to survive. Some feed on the same host throughout their life, and others may feed on different hosts through the different life stages. They can feed on mammals, birds, reptiles, and amphibians. They can cause tick paralysis, which is a rare disease caused by a saliva toxin. It is acute ascending flaccid paralysis, which can often be confused with other neurological disorders. It does usually improve within 24 hours of removing the tick. You should see a doctor if you are unable to fully remove a tick, or if you have signs of infection or illness, including joint pain, muscle aches, swelling, warmth, increased redness, red streaks, a larger rash, pus drainage, fever, fatigue, chills, or headache within several weeks of a tick bite. Be sure to tell your doctor when and where the bite occurred. You should call 911 with serious symptoms such as severe headache, difficulty breathing, throat or mouth swelling, confusion, weakness or faintness, paralysis, and heart palpitations. Ticks can carry many diseases. They can pick up a pathogen from one host and then transfer it to another. The disease may enter the host during feeding from the tick's saliva. Some tick-borne diseases in the United States include anaplasmosis, babesiosis, Borrelia mayoni, Borrelia Miyamotoi, Bourbon virus, Colorado tick fever, ehrlichiosis, Heartland virus, Lyme disease, Powassan disease, Rocky Mountain spotted fever, other spotted fever group rickettsiosis, southern tick-associated rash illness, tick-borne relapsing fever, and tularemia. Anaplasmosis is found in northeastern and upper Midwestern United States. It is transmitted by the black-legged or western black-legged tick, or the Ixodes scapularis or Ixodes pacificus. It can also be transmitted through a blood transfusion. The incubation period is from 1 to 2 weeks. Common symptoms include fever, headache, muscle pain, malaise, chills, nausea, abdominal pain, cough, confusion, and rash is rare. Severe illness symptoms include difficulty breathing, hemorrhage, renal failure, neurological problems, and there is less than a 1% fatality rate, although it is more common in immunocompromised people. Treatment is doxycycline for 7 to 14 days for all ages. They may use rifampin for pregnant women. Babesiosis is found in parts of the northeastern and upper Midwestern United States. It is transmitted by the black-legged or deer tick, or Ixodes scapularis. It can also be transmitted through blood transfusions, and although rare, it can be transmitted congenitally from mother to baby. The incubation period may be weeks or months. Common symptoms include fever, chills, sweats, headache, body aches, loss of appetite, nausea, and fatigue. Severe illness symptoms include low blood pressure, hemolytic anemia, which is the breakdown of red blood cells and can cause jaundice and dark urine, thrombocytopenia, which is a very low platelet count, and this can interfere with clotting, disseminated intravascular coagulation, or DIC, which can lead to blood clots and bleeding, vital organ malfunction, and death. Severe illness is more common with asplenia, the immunocompromised, the elderly, and those with serious health conditions. Treatment is the combination of 2 drugs for 7 to 10 days, and this can include atovaquone and azithromycin or clindamycin and quinine. Borrelia mayoni is a newer bacteria species found in the upper Midwestern United States, and it may cause Lyme disease. It is transmitted by the black-legged tick or the Ixodes scapularis. The incubation period may be days. Symptoms include fever, headache, rash, neck pain, arthritis later in the disease process, nausea, and vomiting. Treatment can include doxycycline for 2 to 4 weeks. They may also use amoxicillin, ceftriaxone, or cefuroxime. There have been less than 60 documented cases of Borrelia Miyamotoi in the United States. It is transmitted by the black-legged or deer tick, called the Ixodes scapularis, and the western black-legged tick, or the Ixodes pacificus. Incubation period may be days or weeks. Symptoms include fever, chills, headache, body or joint pain, fatigue, and rash is uncommon. Treatment is doxycycline for 2 to 4 weeks. They may also use amoxicillin and ceftriaxone. The Bourbon virus is found in the Midwest and southern United States. It is unknown if it is actually transmitted by ticks, although patients diagnosed with Bourbon virus do report tick bites. It is also unsure which tick transmits this virus. The incubation period is unknown. Symptoms may include fever, fatigue, rash, headache, body aches, nausea, vomiting, loss of appetite, thrombocytopenia, which is very low platelet count and can interfere with clotting, leukopenia, which is a low white blood cell count, and the white blood cells are what fights infection, and there is death in some people. There is no treatment available. Colorado tick fever is found in areas 4,000 to 10,000 feet above sea level in the western United States and western Canada. It is transmitted by the Rocky Mountain wood tick, or Dermacentor andersoni. It can also be transmitted through blood transfusions. Incubation period is from 1 to 14 days. Symptoms include fever, chills, headache, body aches, fatigue, sore throat, vomiting, abdominal pain, rash, and stiff neck. About half of those infected have days of fever, then days of improvement, and then a few days of fever. There is no treatment available. Ehrlichiosis is found in the southeastern and south central United States. It is transmitted by the Lone Star tick, or Amblyomma americanum. Incubation period is 1 to 2 weeks. Common symptoms include fever, headache, chills, malaise, muscle pain, nausea, vomiting, diarrhea, confusion, conjunctivitis, and rash in 60% of children and 30% of adults. Severe illness can lead to difficulty breathing, bleeding disorders, and a fatality rate of 1.8%, which is more common in those who are immunocompromised. Treatment is doxycycline for 7 to 14 days, although rifampin may be used for those with severe allergies to doxycycline or for some pregnant women. Heartland virus is found in the Midwestern and southern United States. It is thought to be transmitted by ticks. Incubation period is unknown, although most patients reported having a tick bite within 2 weeks. Symptoms include fever, fatigue, headaches, decreased appetite, muscle or joint aches, diarrhea, leukopenia, which is a low white blood cell count, and this can interfere with fighting infection, thrombocytopenia, which is a very low platelet count, and this can interfere with clotting. Almost all patients are hospitalized, and a few have died. There is no treatment available. Lyme disease is found in the northeastern and upper Midwestern United States. It is transmitted by the black-legged tick, or Ixodes scapularis. Incubation period ranges from 3 to 30 days, and during that time, early symptoms can include fever, chills, headache, fatigue, muscle and joint aches, swollen lymph nodes, and erythema migrans rash, or EM. This occurs in 70 to 80% of the patients. The rash starts at the site and then spreads over days. It may feel warm, but is usually not itchy or painful. It may turn into a target or bullseye rash and may appear anywhere on the body. Later symptoms, which may appear days to months later, include severe headaches, neck stiffness, additional rashes, arthritis, which is severe joint pain and swelling, especially in the knees and other large joints, facial palsy, which is loss of muscle tone or facial droop, intermittent pain in tendons, muscles, joints, and bones, heart palpitations or irregular heartbeat, dizziness, shortness of breath, brain and spinal cord inflammation, nerve pain, shooting pain, numbness, or tingling in the hands or feet, and short-term memory problems. Treatment may be doxycycline, amoxicillin, or ceftriaxone oxidil orally for 14 to 21 days. Ceftriaxone or penicillin IV for 14 to 28 days can be for patients with some neurological or cardiac forms of illness. Powassan disease is found in the northeastern and Great Lakes region. It is transmitted by the deer tick or Ixodes scapularis. Incubation period may range from 1 week to 1 month. Common symptoms include fever, headache, vomiting, weakness, confusion, seizures, memory loss, speech difficulties, and loss of coordination. Severe illness often leads to hospitalization for respiratory support. It can affect the central nervous system, and it may lead to encephalitis, which is inflammation of the brain, or meningitis, which is inflammation of the membrane surrounding the brain and spinal cord. About half of all survivors have permanent neurological symptoms, such as recurrent headaches, muscle wasting, and memory problems. Approximately 10% of Powassan disease virus encephalitis cases are fatal. There is no treatment available. Rocky Mountain Spotted Fever, or RMSF, is found throughout the United States. It is most common in North Carolina, Tennessee, Missouri, Arkansas, and Oklahoma. It is transmitted by the American dog tick, or Dermacentor variabilis, the Rocky Mountain wood tick, or Dermacentor andersoni, and the brown dog tick, or Rhipicephalus sanguineus. Incubation period is from 3 to 12 days. Common symptoms include fever, headache, nausea, vomiting, stomach pain, muscle pain, loss of appetite, and rash usually develops 2 to 4 days after the fever begins. Severe illness can lead to amputation due to blood vessel damage in the arms, legs, fingers, and toes. It can also lead to hearing loss, paralysis, mental disability, and it can be life-threatening. Treatment includes doxycycline for 5 to 7 days. Other spotted fever group rickettsiosis include the Rickettsia parkeri rickettsiosis, which is found in southeast United States, and it is transmitted by the Gulf Coast tick, or Amblyomma maculatum, and the Pacific Coast tick fever, which is found in California, Oregon, and Washington, and it is transmitted by the Pacific Coast tick, or the Dermacentor occidentalis. Incubation period may be a few days to a week. Symptoms include eschar at the site, or a dark scab, fever, headache, rash, and muscle aches. Treatment is doxycycline for 5 to 7 days. Southern tick-associated rash illness, or Stary, is found in southeastern and eastern United States. It is transmitted by the Lone Star tick, or the Amblyomma americanum. Incubation period is within 7 days. Symptoms include a red, expanding bullseye rash, fatigue, headache, fever, and muscle pains. Treatment can include doxycycline or amoxicillin orally for 14 to 21 days, although it is unknown if treatment actually helps. The doctors generally treat it the same as Lyme disease. Tick-borne relapsing fever, or TBRF, is found in the western United States. It is transmitted by the soft tick ornithodora species. Incubation period is 7 days. Symptoms include headache, muscle and joint aches, loss of appetite, nausea, vomiting, and recurring high fevers. Treatment is tetracycline for 10 days. They may also use erythromycin for 10 days or ceftriaxone for 10 to 14 days if there is central nervous system involvement. Tularemia is found throughout the United States except Hawaii. It is transmitted by the dog tick, or Dormocentor variabilis, the wood tick, or Dormocentor andersoni, or the Lone Star tick, or the Amblyomma americanum. Incubation period is from 3 to 5 days. Symptoms include high fever, chills, headache, malaise, fatigue, loss of appetite, muscle aches, vomiting, diarrhea, and you may have an ulcer at the site of the bite. Treatment includes streptomycin, gentamicin, doxycycline, or ciprofloxacin for 10 to 21 days. There are many ways to prevent ticks from breeding. Consider tick pesticides for the yard. Remove any fallen leaves. Clear any yard overgrowth, such as brush and tall grass. Be sure to mow frequently. Create barriers in the yard, such as wood chips or gravel between the lawn and wooded areas. You can place a fence around the yard to prevent animals from entering and bringing ticks, and keep playground equipment and patios away from trees in the yard. Prevent rodent harborages by stacking wood neatly and removing large rock piles. Remove trash and old furniture to prevent hiding places for ticks. You should always take precautions to prevent tick bites. When using an insect repellent, be sure to follow all directions. Do not use a combination sunscreen and repellent, as you are more likely to need sunscreen more often than the repellent. Apply the sunscreen first, allow it to dry for about 20 minutes, then apply the repellent. Do not apply repellent to skin covered by clothing, and do not apply it to compromised skin, such as sunburns, cuts, wounds, and rashes. Also do not apply repellent to children's hands, around their eyes, and around their mouth. Instead, adults should apply the repellent to their own hands and then apply it to the child's face. Apply the repellent outdoors away from food. You may use EPA-registered repellents recommended by the CDC, including DEET in a 10 to 30% concentration. Using more than a 50% concentration provides no additional protection. You should not use more than a 10% concentration on children, and do not use DEET on children less than 2 months of age. You may also use picaridin or IR3535. You should reapply repellent every few hours as needed, and wash it off with soap and water. You may also use permethrin-treated clothing or gear, such as on shoes, clothes, and tents. Do not use permethrin on skin, and do not apply it to clothing while you are wearing it. You can also use permethrin on a mosquito net if it is needed to sleep under. You should also cover up your skin. Wear light-colored clothing, as it is easier to see the crawling ticks on light clothes. Wear a long-sleeve shirt tucked into pants, long pants tucked into socks, socks with closed-toed shoes, and wear a hat to try to keep the ticks out of your hair. Be vigilant about ticks. Avoid wooded areas. Avoid areas with high grass, low brush, and shrubs. Also shady, moist areas, stone walls, and wood piles. Stay in the center of trails. Shower after returning indoors within 2 hours. Be sure to use soap and water to wash off any crawling ticks. Always check your gear and clothes. You may dry your clothes on high heat for 10 minutes to kill any ticks. Ticks can transfer from clothes and gear to people, so make sure there are no ticks left over. Always check your pets after spending time outdoors. The vet can do examinations as well. Consider tick preventives. Talk to your vet. Remove any ticks that are found on your pet. Pets can become ill from tick bites, or ticks can transfer from pets to humans. Be sure to search for and remove any ticks from the body. Use a mirror to check everywhere. Parents should check their children, especially around the ears, under the arms, in the belly button, behind the knees, between the legs, around the waist, and in the hair. When removing a tick, do not handle the tick with bare hands. Instead, use a fine-tipped tweezer to grasp the tick close to the skin surface. Pull the tick straight up with even pressure. Don't twist or jerk it. If the mouth parts of the tick remain attached to the skin, remove them with tweezers. You may first have to allow the skin to heal. Clean the bite area and hands with rubbing alcohol, an iodine scrub, or soap and water. Be sure to dispose of the tick. You may submerge it into alcohol, place it in a sealed container, wrap it in tape, or flush it. Do not crush the tick. Do not use heat, nail polish, or petroleum jelly to remove a tick. Be sure to remove the tick as soon as possible. This concludes the tick presentation. If you have any questions, please feel free to contact your local health department or visit numerous websites that are available online. Thank you.